All right, welcome to our high-yield explainer on silicosis. If you're getting ready for your specialty exams, this is for you. We're going to break down everything you need to know nice and simple. Let's get right into it. First things first, I want to make sure we give credit where it's due. All the content we're covering today is based on the fantastic work of Dr. Mohammed El-Naji Mohammed. So here's our game plan. We'll start with the why, the pathology and mechanism. Then we'll talk about who gets it, the key occupational exposures. After that, we'll hit the classic imaging buzzwords you need to know, walk through a case study, and then wrap it all up with a super quick summary for your exam.
Okay, first up, let's get into the pathology. Really understanding the why behind the disease is what's going to help you nail those tougher second and third order questions on your boards.
So, what is silicosis at its core? Well, it's a fibrosing lung disease. And the main culprit? It's the inhalation of these tiny, fine particles of what we call crystalline silicon dioxide, or just silica. Breathing in this stuff is what kicks off the whole chain reaction in the lungs. Now, here's the key mechanism, the real nuts and bolts of it. When those silica particles get into the lungs, they are straight up toxic to the alveolar macrophages. And remember, these macrophages are your lungs' cleanup crew. They're the frontline defenders. So when silica damages them, the immune system goes haywire, and that's what leads to all the chronic inflammation.
And that brings us to a huge clinical point. This is a classic board question. Because silica messes up macrophage function, patients with silicosis are at a much, much higher risk of developing tuberculosis. You have to remember that link. Silicosis and TB often go hand in hand.
So knowing what causes it leads us right to the next logical question. Who is most at risk? This all comes down to taking a good patient history.
So just take a second to think. When you hear about the imaging findings we're about to cover, what jobs should immediately pop into your head?
You got it. Here are the big four you have to memorize: mining, slate works, foundries, and potteries. What do they all have in common? They all involve cutting, grinding, or drilling rock and sand. That's what kicks up all that fine silica dust into the air. This is why a thorough occupational history is just non-negotiable. Okay, so we know what's happening inside the lungs. Now let's see what it looks like on imaging. For your exam, recognizing the classic radiological buzzwords for silicosis is absolutely critical. There are two features you really need to burn into your memory. First, silicosis is an upper zone predominant disease. That means the fibrosis is worst at the top of the lungs, which is different from a lot of other interstitial lung diseases. Second, and this is the pathognomonic sign, the big giveaway, is eggshell calcification of the hilar lymph nodes. You see that phrase in a question stem? You should be thinking silicosis, period. All right, let's put all this theory into practice. We're going to look at some real patient images and see if we can spot these features. This is where it all comes together. So take a look at this chest x-ray. See how the fibrosis is concentrated way up in the upper lobes? You can see that fine, sort of net-like reticular pattern, but look closer. See those larger, denser white spots? That's a sign of something called progressive massive fibrosis, or PMF. It's a severe complication where all the little nodules start clumping together into these big masses. Of course, a CT scan gives us an even better look, like you can see in this illustration. On the CT, you can really confirm that upper zone predominance. You'd see that mass-like scarring much more clearly, and you'd also spot calcification and signs of volume loss. And you'd get a great view of those calcified hilar lymph nodes, that classic eggshell sign. You might also spot other things, like the left pleural effusion shown here.
Okay, let's bring it all home. Time for a rapid-fire summary of the absolute key takeaways for your exam. If you remember anything, remember this.
Just think of the whole story in 4 simple steps. Step 1, a worker inhales silica dust. Step 2, that dust injures the alveolar macrophage. Step 3, this triggers chronic fibrosis, specifically in the upper lobes of the lungs. And step 4, the classic sign develops, eggshell calcification of the hilar lymph nodes. That's the whole disease process right there. So I'll leave you with this final thought, a clinical pearl. You're reviewing an imaging report, and it clearly describes fibrosis that's concentrated in the upper lobes. Before you think about anything else, what is the single most important question you have to ask that patient? The answer, of course, is what do you do for a living? It all comes back to that occupational history.